It's time to pull out the calendar and circle October 1st. That is, if you don't have any health insurance and you plan on enrolling in health insurance made possible by the Affordable Care Act. U.S. Health and Human Services Secretary Kathleen Sebelius came to Austin today selling that idea.
She met with Central Texas healthcare leaders to answer questions about the new federally run insurance plans. Open enrollment begins on October 1st.
I think it's a brand new day for a lot of folks who have been really suffering from health insecurity, not having coverage or not knowing when they would lose their coverage, seeing rates skyrocket.
But there is a lot of confusion. KXAN's Josh Hinkle found businesses and clinics alike are playing the waiting game when it comes to moving forward.
Kirby Lane Cafe is what the government calls a large employer.
You're full-time with us as well.
5 locations in Austin with 450 employees.
I started as a host and then I moved up to a waiter.
CEO Mason Ayer says they already offer health care insurance to their full-time workers.
So you're working something like 40 hours a week?
But with federal health care changes around the corner, he's faced with switching to another kind of coverage and determining
How many of our employees are going to want to take insurance?
you probably won't see an increase in the price of your food. But Ayer knows his payments will go up. He just doesn't know how much.
We really can't predict what our overall costs will be going into 2015, but we do know it's going to go up some.
It's going to be a very difficult process.
Dr. Steve Margolin agrees there are still a lot of unknowns.
In October, we'll hear, first of all, what insurance companies will be offering plans on the exchanges.
Until then, his patients have questions, but answers are scarce.
As a small group here, how do we fit into that scheme?
It's also a waiting game for Ayer. On top of his costs, his workers want to know where they fit too.
It's going to be a matter of educating them, providing more information.
In Austin, Josh Hinkle, KXAN News.
Attorney General Greg Abbott, who is running for Texas governor, repeated today that Obamacare needs to be repealed. He said fears about the number of uninsured people in Texas are simply overblown.
Just because someone may be uninsured does not mean they don't have access to health care. The percentage of people in the state of Texas with access to health care is in the mid to high 90% range.
Abbott refused to say whether he agrees with lawmakers who have talked about shutting down the federal government in their quest to get rid of Obamacare.